Thank you, and welcome to our third Apple expansion webinar, where we'll be discussing eligibility of the upcoming Immigrant Health Program. My name is Sarah Tunnell. I use she, her pronouns, and I'm the Senior Project Manager for the Apple Health expansion. This webinar is being recorded, and by staying in this webinar, you consent to being recorded today. This is a Zoom event in webinar mode. Attendees will not have microphone or camera access during this online event. Attendees' voices, likeness, and/or images will not be captured. Special thanks to Paula Meyer for ASL interpretation this afternoon. Closed captions are available in English and in Spanish, and we will share the closed captioning links several times throughout the webinar. You may submit questions throughout the presentation using the Q&A feature that we have, and we'll have a question and answer section at the end of the presentation. All web pages and additional resources will be shared at the end of the slide deck. I believe we can go to the next slide, please. Your hosts this afternoon are Becky Carroll and Giovanni Delgado from the Healthcare Authority. I'm going to pass it to Becky, who's going to start going over some background information.
Good afternoon, everyone. Welcome. As Sarah noted, it's good to have such great attendance on this topic. And I just want to thank you all for joining, and we look forward to the question and answer period at the end. But for now, I will hand the microphone over to Giovanni to walk us through the slide deck. Gio?
Yes, thank you. Good afternoon, everyone. Today is going to be part one of the Apple Health Expansion Enrollment Program. And next slide, please. So the topics we'll be covering, we're going to do a quick overview of the current Apple Health programs. And then we'll be covering the Apple Health Expansion, going over the eligibility, application pathways, the application process, getting ready to apply, and the program hierarchy. So the current Apple Health programs, next slide, please. Since the Affordable Care Act, the Healthcare Authority has been serving immigrants through Washington Health Plan Finder and Washington Connection application systems. Almost 100,000 immigrants have interacted with the application system over the last year. There are over 43,000 individuals without an immigration status eligible for Apple Health for Kids and Apple Health pregnancy medical programs. Next slide. So the Apple Health programs today, individuals who do not qualify for federally subsidized healthcare coverage because of their immigration status may continue to qualify for other Apple Health programs, such as medical care services, alien emergency medical, Apple Health for pregnant individuals, after pregnancy coverage, and Apple Health for kids. Lawfully present non-qualified immigrants will be eligible, as well as undocumented are eligible. So in 2022, the legislature provided funding to the Healthcare Authority to implement a new program to provide healthcare coverage equivalent to Apple Health, Medicaid, to uninsured adults who are ineligible for other federal programs due to their immigration status. So HCA received additional fundings in 2023 to continue with the program. The Apple Health expansion will launch July 1st of this year, 2024. Program funding was not at the level requested, and HCA must limit the number of individuals who can enroll. The eligibility, next slide. Who is eligible? Washington residents who are 19 years of age and older, income at or below 138% of the federal poverty level, and those individuals who are not eligible for other Apple Health programs based on their immigration status, or qualified health plans with premiums, advanced premium tax credits, or federally funded medical programs. Next slide. Where possible, HCA will use the same procedures as Apple Health, including eligibility, enrollment, redeterminations, and renewals. Enrollees Enrollees will be able to choose one of these 4 managed care programs: Molina Healthcare of Washington, United Healthcare Community Plan, Community Health Plan of Washington, and Coordinated Care. HCA, the expansion will operate much like our integrated managed care programs today. Expansion will be a managed care program. The agency intends to contract with existing managed care organizations. Next slide. Program policies. There is no retroactive eligibility for Apple Health expansion. Clients may get retroactive coverage under the Alien Emergency Medical if they had a qualifying condition in the retroactive months, and after pregnancy coverage if they were within 12 months of a pregnancy ending. And there are no resource or assets limits in this program. Application pathways. Next slide, please.
One second while I unshare and reshare.
I apologize for having some difficulties. Would you like me to share my screen?
What would be best here? Oh, there we go.
Okay.
I had to switch to the PowerPoint.
Understood. Thank you. Gio, are we on the right slide?
We were starting in the application pathways.
So I think we have that. Is this the first or the second slide here? There we go.
Yes, there we go. Yes. Okay, so they will be able to have access to Apple Health expansion the same exact way that they do for Apple Health currently. There will be 2 entry points for the expansion. So for those under the age of 65, they'll be able to apply using Health Plan Finder. So those will be for the adults ages 19 through 64. And they can apply online going to whyhealthplanfinder.org. They can also download the Health Plan Finder mobile application. They can call the number that's on the screen. They can also submit a paper application, or they can also go to an in-person and see a navigator to assist them with the application. Next slide, please. Okay. So for adults age 65 or older, they will apply through Washington Connections. DSHS will manually process those applications, and they can do so by going online through washingtonconnections.org. They can also call the number that's on the screen. They can also submit a paper application, or they can go in person to a DSHS Community Service office and apply. So managing enrollment, HCA can enroll up to 13,000 individuals into the program. If the enrollment cap has been met, an applicant who is otherwise eligible will receive a denial notice. All clients may purchase a qualified health plan. Clients under 250% of the federal poverty level are eligible for Cascade Care savings if they enroll in a Cascade Care plan. Staff will accept client attestations of their income, citizenship and immigration status, Washington residency, and all other eligibility factors. If the individual indicates a need for services covered under the Alien Emergency Medical Program and the Apple Health Expansion Program is not limited, individuals will be approved for the Apple Health Expansion, but it is limited, then the cases will be reviewed for eligibility into the Alien Emergency Medical Program. Both programs cover the same services as AEM. Individuals denied for Apple Health Expansion in Washington Health Plan Finder due to the enrollment limit will receive an eligibility notice of health coverage options. As I mentioned before, clients under 250% of the FPL are eligible for Cascare savings if they enroll in a Cascare plan. So getting ready to enroll, be sure they have all documents needed to avoid a delay in getting coverage. Proof of identity may include a driver's license or ID card, even if issued from a foreign country, immigration documentation if they have it, third-party affidavit or federal or state agency letter confirming their identity. Household members not applying for coverage do not need to verify identity. And Social Security number should be provided if the individual has one, but it's not required. And it is important not to provide an ITIN number. Just really quick on the previous slide, please. Okay, it's important to note that the SSN for the clients, individuals that have one, will be used only to determine eligibility by confirming identity. It is not used for any other purpose. Next slide. Okay. Washington Health Plan Finder requires the primary applicant pass identity proofing before continuing with the online application. And that is not needed for a paper application submission. They must have identification information such as their name, date of birth, their weight, height, eye color, age, sex, and race. In-person ID proving does not require uploading any type of documentation into Health Plan Finder. And please see the link below for the acceptable documents. If an individual is working with a navigator, the navigator will be able to verify their identity and upload any documentation, and uploading any documentation will not be needed. Be sure the individual's name matches how it is spelled on their documents. If the individual has two last names, follow the application data entry standards on how hyphenated names should be entered. As an example, first name, last name, or first name, last name, or first name, last name. They must provide gross monthly income for the client and spouse on the application. If an individual wants help calculating the amount to provide on their application, they should have their wage stubs, at least a month or 2 months worth of wage stubs, receipts that show their earnings, or a letter from their employer or a phone number to call to get that information, an IRX form 1040 chart, and below there's a link of acceptable documents that they can provide for the tax forms. When reporting income for individuals whose income varies seasonably, individuals can choose to use either the point-in-time methodology or by calculating the monthly average. As an example, a fisherman or farm worker who may work seasonally during the summer, they can provide that particular amount of wages, and then it can be divided into different months to get an average. So program hierarchy, here we have some examples. Hannah, who's 68 years old, his income is $950 a month. She lives in Wenatchee. She's not active or eligible for Apple Health programs due to immigration status. Based on her age and income, she would be eligible for the Apple Health expansion through DSHS. Next slide. Carmen is 30 years old. She's a family of 4 with monthly income of $3,400 a month. She's pregnant and due in January of 2025. She lives in Everett. Carmen is now eligible for Apple Health expansion as they are eligible for the Apple Health for pregnant individuals. Ken is 25 years old and is a DACA recipient. His income is $1,650 a month. He lives in Blaine. He's not active or eligible for other Apple Health coverage due to his immigration status. He would be eligible for Apple Health expansion through Health Plan Finder. Jeff is 38 years old with an income of $1,150 a month. He lives in Everett. He meets the 5-year bar in July of 2027. Jeff would not be eligible for Apple Health expansion as Jeff is eligible for federal subsidies, but may qualify for AEM. He may also purchase a qualified health plan with tax credits or Cascade Care savings if they enroll in a Cascade Care plan. Natalia is 55 years old with an income of $2,200 a month. She lives in Bellingham. She's over income for the Apple Health expansion. So all clients can still purchase a qualified health plan. Clients under 250% of the federal poverty level are eligible for Cascade Care savings if they enroll in a Cascade Care plan. Next slide. Okay. Resources. Okay, so we have some available resources, some flyers to share at outreach events. They are translated into 15 languages. Below is the link that you can use to reach this flyer. And all you have to do is just search for the Apple Health expansion coming July 2024. So the next webinar will be scheduled in late May or early June, the second part of this webinar. And the stakeholder webinar is in a variety of languages, which will be posted online. And continuation is different resources available. So we have the client webpage. There's also the stakeholder webpage, the Apple Health page for non-citizens, and the enrollment cap announcement link. And that is the end of our presentation. Thank you. And now we have time for Q&A.
Thank you, Gio, for going over that with us. So we do have some questions that have come in. All right. And so some of the just very basics about the slides and that information that will be posted on our webpage, and I'll pop that link in chat for folks here in a moment. And so you'll be able to see the recorded presentation as well as the materials. Will income standards for Apple Health expansion be the same for people 65 plus?
Yes, the income standards for both those applying through Health Plan Finder and Washington Connections is the same. It's 138% of the FPL.
Okay. Will there be a waiting list implemented?
That's a great question, and we get that quite a bit. I will note that we will not have an automated wait list when we go live on July 1st of 2024. So by automated, I mean an IT-based solution wait list. That is something that the agency will continue to work on post-implementation, and will provide more information about how we will manage the enrollment cap once it is met. So between that point and when a automated or IT-based wait list is available, either at the next webinar or in early June.
Thank you, Becky.
Hmm.
When could the client submit the application for the expansion for the start date on July 1st?
Yes, clients can start applying for the expansion starting June 20th. That's the day that applications will start getting processed for the expansion.
All right, because we know this is a capped program, will the cap be first come, first serve, or will there be a priority process?
Another great question that we've gotten quite a few times. So it will be first come, first serve, though I will note there are some populations that we have discussed in our other webinars that will automatically transfer to Apple Health Expansion. One are, there are a few, but the first one would be anyone who is currently enrolled in our emergency medical or AEM program. Individuals who are enrolled in a qualified health plan or qualified health dental plan as part of the 1332 waiver at the health benefit exchange, who are eligible for Apple Health Expansion, will be transitioned over to the program on July 1st unless they opt out. And then, of course, anyone whose coverage is ending in an Apple Health program, such as Apple Health for Kids, if they're aging out, and then individuals whose after pregnancy care coverage or other coverage is ending, and who are eligible for Apple Health Expansion, will be transitioned over as of July 1st. Gio, Rebecca, Janesco, anything more you would add to that?
No, I think you got it. You got it all.
All right. So some of the folks who have are present with us have also been present with the qualified health plan expansion that came from the health benefits exchange. And so they're asking, what are the differences between enrollment in November and now? It seems like much of this is similar information.
I'm happy to start that off and then maybe ask someone from Health Benefit Exchange or our eligibility team to pipe in if I'm missing any pertinent details. I would say that they are similar in that a vast majority of folks will be enrolling into Apple Health Expansion using the Washington Health Plan Finder platform at Health Benefit Exchange. They will be entering very similar information. It is just that we'll be looking at their eligibility a little bit different, and that we're looking for individuals who are 19 plus and below 138% of the federal poverty level, who would then be eligible for Apple Health Expansion. And so we're really just looking at some eligibility determinations that are a little bit different. Rebecca, Gio, anything I might be missing there?
No, it's just just clarifying that the health plan finder system is used for both applying for plans through the benefit exchange as well as applying for Apple Health. So if somebody applies for Apple Health benefits and may be considered ineligible due to their income being over, without the need to have to go to another system and apply, and it gives them that option right there and then to look at other plan benefits through the exchange.
All right. So we have a question here about the Washington connections process, since that's a paper process and takes longer. Are there a set number of spaces available for those clients over the age of 65, since that application process is different?
Sarah, could you repeat that? I did not hear the first part there. I'm having some.
Yeah, that's okay.
Yeah, no
Um,
problem.
So we know that the Washington Connection System is a paper-based application, and that can take longer. So are there a number of spaces being saved for clients over the age of 65 who are going to use that Washington Connections?
Another great question. Yes. So we are able to enroll up to 13,000 individuals into Apple Health Expansion. We recognize that Washington Connections is paper based. There is an online feature as well for that particular program or that particular platform rather. But we are holding back about 10% of our spots, or 1,300 spots for individuals who will be accessing the Apple Health Expansion program through Washington Connections.
Okay, and we have some questions coming in about these enrollment numbers. It isn't a limited enrollment cap. How will folks be notified when the cap has been met? Will that go out on our socials, or how are we going to notify folks of that?
So once the cap is met, individuals applying for Apple Health Expansion who aren't eligible for another program, although I would say all of them would be able to purchase a plan through, or most should be able to purchase a plan through Health Benefit Exchange, or at least have that option. They'll receive a denial notice for Apple Health Expansion that the cap has been met, the enrollment cap has been met.
All right. So we've got just answers just flowing in still. Let's see. Will Apple Health Expansion cover behavioral health services?
Yes. Apple Health Expansion is mirrored after our integrated managed care plan and will cover both behavioral health and physical health services.
And if someone applied for Apple Health in 2023 but didn't qualify due to immigration status, can they reapply?
I'm sorry, could you repeat that question, please?
Yes, if someone applied for Apple Health in 2023, but they didn't qualify due to immigration status, can they reapply?
Yes, if they didn't qualify due to their immigration status to our other Apple Health programs, they can apply for the expansion.
Will individuals over the age of 65 be able to apply in person at DSHS CSO offices on June 20th?
Gio, Rebecca, I believe the application, go ahead, Gio.
Yes, the application process starts June 20th, so they can use any of the modalities to start applying at that time.
Okay. There's some very technical questions in here that I think will probably be added to our Q&A. I'm looking to see if there's anything more generalized. Are individuals who have an employment authorization card eligible for the expansion program?
Sarah, I think that's a great question. I'm going to yield to our eligibility partners. I'm not sure if we need to take that one back or not.
Okay. So this is about an employment authorization card. Can that be used for the expansion program?
If they're eligible for the federal tax credits or the subsidies, they would not be eligible for the expansion.
Okay.
Sarah, I'm noting in here, there's some questions about long-term care coverage.
Okay, I missed that one. I was going to go to an enrollment cap one next.
Oh, I'm sorry, Sarah. I just wasn't
Okay.
sure.
I'll hopefully I can grab that one. Let me this is a very interesting one. This is for you specifically, probably, Becky.
Okay.
So after that 13,000 enrollment cap is reached, will slots become available as people come on and drop off of the program? Or is this 2024, it's a one-time offer for the community?
Yeah, I really appreciate that question. So really the agency has been working to ensure we have a process to manage an orderly enrollment for implementation on July 1st. And so you've heard we're going to open the application process up on June 20th and manage enrollment until we have met our cap. And we are still really thinking through how we're going to manage the cap. So that capped enrollment, folks that are coming in who are receiving denials because the program is capped. And we have not worked out all of those details yet. You heard me note we don't have an automated IT wait list solution for this. And so there are some things that we need to consider internally. We will be thinking that through and sort of discussing that with key stakeholders and with our sister agencies, DSHS and Health Benefit Exchange in the coming weeks. And we hope to provide additional details at an upcoming webinar about what that will look like once the cap is met. So it's a really great question. And we hope to have an answer to that one pretty quickly.
All right. And yes, now we have also some questions about a partnership with our sister agencies. Does this cover long-term care and in-home caregivers for clients?
So Hopple Health expansion service dollars were provided to Healthcare Authority. And so the long-term care services that are traditionally covered by DSHS's Aging and Long-Term Services Administration are not included in Apple Health expansion.
And we have some specific questions about the AEM program as well, since there is interest in that since folks are transitioning over. Do we know how many folks we're expecting to transition over?
So I think in total, and that number fluctuates a bit because AEM, by its very nature, the eligibility and therefore the number of people enrolled in that program changes quite a bit, as you can imagine. Emergency medical services covers emergency room, emergency associated services, like you would imagine. It also covers cancer treatment, dialysis treatment, and post-transplant treatment. Those other three services, there's less people kind of moving in and out of that. But the emergency room does make that a little harder. In total, I think between all of the Apple Health programs and the QHP expansion program, we're expecting approximately 3,000 individuals to transition in automatically on July 1st, Sarah. I don't know that I have the exact number for AEM, and I don't know, even if I gave you the number today, if that would be what would be reflected July 1st when that transition happens.
That's okay. I've got another AEM question here. So that program, does it have different income limits? Because if a person makes above the income for Apple Health expansion, but they're on the AEM program, will they continue to stay on the AEM program?
Yes, they will, Sarah. So our AEM program will continue. That's a great call out. There is a bit of a nuance here, right? In many of our Apple Health programs, there are different FPL and eligibility requirements. And so this will not change post implementation. The individuals that will be transitioning from AEM to Apple Health expansion meet the eligibility requirements for Apple Health expansion. Everyone who is at a higher FPL and doesn't meet Apple Health expansion requirements will stay on AEM and continue to receive those services under that benefit program or that coverage program.
And I have another real specific AEM question. What about people with pending AEM coverage? Will they be auto-enrolled into the Apple Health expansion, or will they remain in the pending status while that application is reviewed?
Normally they're in the pending status because we're determining eligibility. I think we're gonna maybe need to take that one back, Sarah. That's a little bit more complicated.
Okay.
I'll just pause there in case Rebecca or Gio have a better answer to that.
Yeah, we'll have to take that one back and provide guidance later on.
Okay, thank you.
Yeah.
On June 20th, will clients receive a decision right away if approved, or will a letter be sent on July 1st?
I can answer that. I'm Rebecca Janesco with the eligibility team. If they apply through Washington Health Plan Finder, they'll get a decision right away. If they apply through DSHS, it may take several days for DSHS to process the application. And that's because of the difference in how applications are processed with DSHS, which is a manual process, versus Health Plan Finder, which is a live decision.
All right, thank you. And to confirm, Apple Health expansion will cover dental and vision as well.
So Apple Health expansion will cover dental services and vision screenings, yes.
Okay, I think I've captured the questions that aren't too specific that are for our generalized audience today. There is a question here for DSHS. I'm not sure if our sister agency is available to talk about that, but how long will the processing time take of the application?
DSHS reported this morning that they're processing applications for Medicaid within 12 days. We do expect decisions to come in the mail within 2 weeks of applying.
Okay. And I see a new question that's come in here about a communication toolkit. I do know that we are in the process of developing that communication toolkit, and we have some of our communications partners on with us who can answer that question.
Hello, this is Nathan from the Apple Health Client Communications team. And yeah, so for the communications toolkit, we have that set to publish soon this week. And of course, this is going to be a publication that will be updated routinely. There's some materials that will be added to it that will include things that are still developing, such as an Apple Health expansion client flyer, social media post templates, things of that nature. So I don't have a specific date, but this week is when we'll have the first version of that, and we'll update that on the webpage and then send a cup delivery about that so that folks are aware.
All right, thank you, Nate. All right, Becky, I'm going to pass it back to you.
Okay. just looking through. Let me check in with Rebecca and Gio and see if there are any questions that we can answer live that you're seeing here that we haven't yet.
There are a few questions about refugees and asylees and whether they're eligible for Apple Health expansion. I know refugees are not because they're eligible for Apple Health adults and the other programs. So if they're eligible income-wise as a refugee, they will be approved for Apple Health, but not the expansion program. Giovanni, are you able to answer the question on asylees, whether they're approved asylee or their asylum status is pending and their eligibility for Apple Health expansion?
Yes, if they are approved on asylum status, they have the same benefits as those refugees. So they would be eligible for regular Apple Health. They would not be eligible for the expansion. As far as when they're on a pending status, it will depend on whether they have been employment authorized or not, and whether they have a Social Security number with which they can be qualified for the advanced premium tax credit. So there's different things that can happen when they're on a pending status.
And I'm noting there's quite a few questions that are a little bit more complex in nature. And like Sarah noted, we'll be adding those to an FAQ from this webinar, and that will be posted on our web page. And that should be accessible to anyone attending or navigators, sisters. Those should be documents that are available to any and all who want to access them on our web page. Noticing a couple of questions about the difference between Washington Apple Health expansion and the QHP expansion program. So I will note again that Washington Apple Health is a separate program. And for those who are eligible and who are able to enroll prior to the cap being met, the Washington Apple Health expansion program that we've listed today would be providing coverage for them for both behavioral and physical health needs, non-emergency medical transportation, language access, dental services, etc. If someone is coming in after the Washington Apple Health expansion program is full, one of the options will be to purchase a program, a plan off of the health benefit exchange, which we've been referring to as a qualified health or qualified health dental plan. I know that we have some of our health benefit exchange partners on the line. Jenny and Joanna, are there any questions that you've seen that you want to highlight verbally for the group?
Hi, Becky. No, I think you covered it, just the difference between QHP's qualified health plans and Apple Health. But yes, there will continue to be qualified health plans available to everyone after or if the program cap has been met. And folks that aren't able to enroll in the program because the cap has been met will be eligible for Cascade Care Savings, the subsidy, to reduce their cost.
Checking in with you, Sarah, if there's anything else you're seeing that we should be answering live.
We just got a new question about humanitarian parolees. Are they eligible for Apple Health expansion? This is a new question.
Yes, thank you. We'll have to take that question back and get a concrete answer for it, because there are different nuances when it comes to that group.
I can appreciate that, Gio. Thank you. So a couple of clarifications. I think I've seen a couple questions here. So if a client fills out an application on June 20th and they're deemed eligible for Apple Health expansion, their coverage will begin on July 1st. I think that was one of the questions. Just looking to see if there's anything more. And so I will give my agency partners a minute here to take a quick peek if there's other pieces here that we can answer right away.
We do have a question. So
Mhm.
folks who are going to be part of the transitioning group, they're on a qualified health plan now, the
Mhm.
QHP, will they be auto-assigned to a managed care organization, or will they get to pick their own?
It's a great question, Sarah, and I appreciate that being highlighted. So we have a current process between individuals who are coming from a QHP plan now into an Apple Health plan. And if it is a managed care plan, they are given the opportunity to choose their managed care organization. And that same choice will be afforded to individuals moving from a qualified health plan, qualified health expansion plan over to Apple Health expansion.
There, I do see at least one question about the 5-year bar for Medicaid. So we have mentioned this a few times, and so basically a brief explanation of what the 5-year bar is for Medicaid and its impact on Apple Health expansion. So Gio, is that something that you can address?
Yes, definitely. So for clients who get approved for an immigration status of permanent residence, they have to meet a 5-year bar before they're eligible to receive Medicaid benefits, and this is a federal guidelines, federal mandates that indicate that they have to wait those 5 years before being eligible. So for that population that is within those 5 years, they will not be eligible to apply for the expansion because they'll be able to, they are eligible to receive advanced premium tax credits through the exchange. So they will not be eligible for the expansion. And once they meet those 5 years, after those 5 years, then they would be eligible may be eligible for the Medicaid programs. However, this does not apply to children or for pregnancy programs. This is only for the adult medical programs that they would not be eligible or the expansion.
Thanks, Gio.
Sure. And I'm sorry, they would also be eligible for the Alien Emergency Program as well.
I am seeing a couple of questions here about how long funding for Apple Health expansion is continued or is expected to be continued. I will note that the program is not an entitlement program unlike Medicaid. It does sit in the state budget. And what that means is that we do need to have the funding for that approved every legislative session for the program to continue. And let's see here. And I will just note, I do see a couple of questions about when the program, when you can start to enroll in the program. So I'll just reiterate that that will happen on June 20th, and people will be able to start applying for Apple Health expansion coverage on June 20th of this year.
All right, Becky, I think we can go over the last couple of slides that we have available for folks. And as I mentioned, we're going to take all these questions, especially the more technical ones. There were a number of scenarios, and we will take those back and develop an FAQ and post that on our site in the future, as well as we'll send out a Gov delivery when that's available. So I'll post all those things in the chat again.
I think we are on the last slide, Sarah. So I will note that the Washington Apple Health expansion email address is there. And then I think, are we going to put in chat, I think the links to the website and the Gov delivery? Perfect. And we do appreciate everybody's questions in the chat. And there are some, we are keeping track of all of those. We will provide a written answer for some of them because they are a little bit more complicated and nuanced. Or there are things, like I noted before, that are in regards to what happens after we've met our enrollment cap that we are still working on our policies around. So one last check in with let me start first with Jenny and Joanna. Are there any questions in the question and answer fields that you would like to address verbally that we haven't yet?
Do not see any QHP specific questions that we have not addressed in the chat. Thanks for checking in, Becky.
Yeah, no problem. Rebecca and Gio.
Nothing at this time. We do have a couple of questions that we are taking back to get more clarification.
Makes sense. All right. Sarah, I think we have covered it for this afternoon.
All right. Thank you, everyone, for your time. And we look forward to meeting with you again soon. Take care.
So.